Diastasis recti, also known as DRAM. DRAM is when the muscles in your tummy, called the rectus abdominis, more commonly referred to as the six-pack, widen down the middle. During pregnancy, this area widens to accommodate your growing baby. Every woman will have some degree of separation by the end of pregnancy, and this is an accepted and normal part of pregnancy. Some women find that the separation disappears in the weeks following childbirth, but some may still have a separation months after. What to look for? Lying on your back, if you gently raise your head up and feel the midline of your stomach, you may be able to feel a dip between the muscles. This is measured by how many fingers can fit in the gap, and size will differ between individuals. You may also notice that the midline of your stomach rises. This is called doming. These all indicate a DRAM. If DRAM is affecting your abdominal strength or quality of life, the exercises below will help. If you require more guidance, please see a pelvic health physiotherapist. How common is DRAM? It is commonly accepted that 100% of women will have some degree of DRAM by the end of pregnancy, and about 1/3 will remain with it in the months following childbirth. Risk factors. Several factors may contribute to the degree of DRAM. These are pregnancy, especially more than one pregnancy or having twins or more, genetics, heavy repeated lifting, frequent straining with constipation. What can you do? 1. We advise that you adapt or avoid any movement that causes a firm bulging or dome between the separated muscles. Some examples are: squeeze your pelvic floor, stomach muscles, and support your stomach when you cough or sneeze. Get out of bed by rolling onto your side. Let your feet hang off the bed and push up sideways. Squeeze your pelvic floor as you do this. Do the sequence in reverse to get into bed and squeeze your pelvic floor. Squeeze your pelvic floor and stomach muscles before you lift or lower your baby and when lifting the car seat or buggy. If the bulging or doming is soft and not painful, you do not need to be concerned. 2. Avoid holding your tummy in all the time. It is important for the normal function of your pelvic floor and stomach muscles that you allow them to relax when they are not needed. 3. Avoid constipation. Make sure that you drink adequate fluids, 1.5 to 2 litres a day. Maintain a good diet with adequate soluble and insoluble fibre. Try to develop good toileting habits. Sit fully on the toilet, your feet should be flat and your knees should be at 90 degrees or higher. Use a footstool to raise your feet if you have one available. Never strain. Instead, purse your lips and blow out as if blowing out candles. You may find that supporting your abdomen with a pillow or your hands during a bowel movement helps. For more advice on managing constipation, visit www.patientwebinars.co.uk and select constipation. 4. Exercises. The following exercises are designed to begin strengthening your pelvic floor muscles and deep tummy muscles too. They are safe to do as soon as the days following childbirth and can be done daily. 1. Pelvic floor exercises. In lying or sitting, put your hand on your tummy. Take a slow breath in so that you deeply fill your lungs. As you breathe in, your tummy should inflate under your hand. As you breathe out, squeeze your pelvic floor from your back passage round to the front. You should aim to do 10 fast squeezes and 10 reps of 10-second holds as well. To learn more about how to do a pelvic floor contraction, please watch the pelvic floor exercise video. 2. Pelvic tilts. In lying with your knees bent and feet flat on the floor, put your hand on your tummy. Take a slow breath in so that you deeply fill your lungs. As you breathe in, your tummy should inflate under your hand. As you breathe out, squeeze your pelvic floor muscle and tilt your pelvis. Draw in your tummy muscles as if shortening the distance between your pubic bone and your belly button. You should feel your lower tummy muscles tighten. Hold for 5 seconds and relax. Repeat this 10 to 20 times. 3. Heel slides. In lying with your knees bent and feet flat on the floor, put your hand on your tummy. Take a slow breath in so that you deeply fill your lungs. As you breathe in, your tummy should inflate under your hand. As you breathe out, squeeze your pelvic floor muscle and slide one foot out to straighten the knee. Slide the foot back in as you breathe back in. Repeat this 10 to 20 times on each leg. If you are concerned about your tummy gap or exercising does not make any difference, please get a referral to see your local pelvic health physiotherapist.